Good evening to all. Today's medical term that we'll be discussing is hemodialysis. Yes, your guess is right. It is a treatment used in patients suffering from a kidney failure. Generally, it is done for about 3 times a week and each session lasting about 4 hours. But if it's done at home, they prefer for a 2 hour per day session or a nocturnal session of 8 to 10 hours. So, this particular treatment methodology uses a machine called a dialyzer. It works just as a kidney. So, the main purpose of using this treatment is to filter the waste products and excess fluid from the blood, and thereby controlling blood pressure and maintaining the balance of minerals such as potassium, sodium, and calcium, that is, electrolytes, and thus sustain life in patients suffering from a kidney failure. This can be used for a temporary period when you suffer from acute kidney injury or a lifetime treatment for people suffering from chronic kidney failure. So the general procedure that is followed is where initially you using a minor surgery, you create a vascular access point. And the meals and the fluid intake schedule has to be maintained, especially the meal plan should limit the intake of sodium, potassium, and phosphate ions. So, what is the overall procedure? As mentioned earlier, first a vascular access point is created. The access point can either be arteriovenous fistula, which can take about weeks to mature to be used, or a AV graft where a synthetic tube connecting the artery and vein is introduced, or a venous catheter where a temporary tube is inserted into the vein in the neck or in the chest. During this treatment, two needles are inserted into the access site and a flexible tube is connected to the machine. Blood flows via the needle and through the dialysate, that is the cleansing fluid, which flows in the opposite direction, the blood is filtered and the filtered blood is returned. Throughout this procedure, blood pressure and heart rate is monitored, and as the technique is completed, needles are removed and the pressure dressing is applied. This technique has certain risks like pressure being decreased, vascular access issues, fluid overload, and some bone diseases.